Hello, everyone. Good afternoon. Can you hear me?
Hi, BC. Hello.
Hi, BC. We can hear you.
Okay, great.
Yes. Welcome, everybody, and thank you for joining our session this afternoon. Multi-generational voices in delivering the SDGs in the new normal, in our new world of today. A lot of people have asked me the meaning of that title. I'll talk about that later. I just want to say once again that we really appreciate your taking time out to be with us today. And my name is BC Adebayo. I'm the convener of this meeting. I'll also be moderating the panel. I am one of the founders of the Bridging Development Gap. That is the organization that's organizing the meeting. From the title, you guess what we are about. It's an international grassroots organization, and our desire is to alleviate poverty, remove all inequalities, and help in accelerating the sustainable development goals. I think we have all our panelists here now. Without further ado, I'll start by introducing, as you all know, before I go on, today is the International Day of Youth. And this is a UN recognized day celebrated annually to recognize the participation of young people, their contribution to sustainable development to the world. And that is why we chose today, especially because we believe that in order for the SDGs to be achieved, it cannot be done without all hands being on deck. We need everybody on board, irrespective of the age. Recently, the COVID, which is still ongoing, has left a lot of damage to the world, and a lot of humanitarian activities that have been on hold. And as a result of that, a lot of people have been impacted, especially the vulnerable population, which is one of the reasons for today's meeting. So let me go right into introducing our guests, our panelists. We have Chibuna. Chibuna, I see you are there. Chibuna.
Yes, good day, everyone.
Yes, nice to see you. That's
It's a pleasure to be here.
Yes, he's the founder of Renew Cycle, right? Also the global sub-regional coordinator for the Global Youth Energy Outlook. He'll be introducing himself much later. I can also see Princess there. Princess, do I need to unmute you?
Okay.
Yes, I can hear you. Yes, that is Princess. She's the CEO and the national coordinator for NEPAD in Nigeria. NEPAD is one of the implementing development agencies arm of the African Union. Who else can I see? We also have the country representative of UNFPA, Dr. Kim Dixon. I haven't seen her online now, as well as Mary. Mary Balinkugeri is the founder and executive director of Rwanda Women's Network, based in Kigali. So let me quickly share my screen with you so that I can introduce you. Yes. Okay. Yes, let me introduce BDG in a nutshell. I'd said that our mission is for inclusive participation of all. We work with intergenerational dialogue we are trying our best to translate the Sustainable Development Goals to ensure meaningful participation of all. We believe that for Sustainable Development Goals to be achieved, every hand has to be on deck. And for those who are not very familiar with Sustainable Development Goals, there are 17 of them. These goals were agreed to, signed into by 169 members of the United Nations in New York. And the ultimate goal is to end poverty. So there are different goals that touch on zero hunger, good health and well-being, quality education, all different aspects of the society that need to be aligned together for us to end poverty. January this year, the UN Secretary General declared 2020 as the decade of action. And that is simply because this is the beginning of the next 10 years to the end of the SDGs, which is when all the goals are expected to be delivered. I think. So, and our objectives, we have 4 specific objectives. We work with 6 of the SDGs, education and development, health, socioeconomic development and empowerment, and we also believe in partnerships. So I stop sharing my screen now, and then I will now pass the mic on to my different panelists to introduce themselves. So I'll start with you, Chibuna. Can you do a quick presentation of yourself and what the organization is all about? 3 minutes. Chibuna, can you unmute yourself?
Okay, can I share my screen?
Well, you want to introduce yourself before you start your presentation.
Okay. Thank you very much. I'm very grateful and delighted to be on this panel. My name is Chibuna Obuna. I'm from Nigeria, and I'm the founder of Renecycle Energy Limited for food, and also the regional coordinator for Sub-Saharan Africa, Global Youth Energy Outlook. So at Renecycle, we make affordable and efficient inverters and battery packs for students, young professionals, rural communities, and local health centers to provide affordable and clean energy for them. So the Sustainable Development Goals I'm working on is the SDG 7, which is very important for achieving the other SDGs. And for the Global Youth Energy Outlook, I'm working as the regional coordinator for Sub-Saharan Africa. We are looking to engage 5,000 participants in Sub-Saharan Africa to get the views of what youth want for the sustainable energy transition by 2030. So, and we are doing this to bridge the gaps between youth and also businesses, governments, and other institutions in Africa and in the world. Thank you.
Thank you so much, Chibuna. I'll now move on to Princess. Princess, would you do a short, brief introduction of yourself?
Yeah, thank you very much. It's quite a welcome development to put together such a fantastic program, especially today that is our International Youth Day. Before I introduce myself, I want to say that the youth are the engine room of our nation, of our future. And I congratulate every youth of the nation today, and I celebrate them because we were all once a youth. And the foundation laid today leads to greater future and tomorrow. So my name is Princess Gloria Kobundo, and by the grace of God, I'm the National Coordinator and the Chief Executive Officer of New Partnership for Africa's Development. And I'm not surprised I'm talking with the youth today, being the Youth Day, because our major mandate is for the development of women and youth. So I welcome all of us to this great event. Thank you.
Thank you so much, Princess. One of our panelists is having problems getting in. Without, yeah, well, we'll wait for them. When they come in, they'll be introduced. So today's panel, we have a few objectives that, apart from today being the International Youth Day, we would like the session to contribute to knowledge on bridging development gaps, as well as reduction in gender inequalities in health, education, water, hygiene, and sanitation. Recommendations from this meeting will be put into a technical brief, which will be used as an advocacy document. We are also hoping that the meeting will will come up with strategies.
No, I mean, I thought that one. Then you did you see Anna's
one of our participants. Yeah, please unmute. Everybody, please mute yourselves. Finally, we would like to highlight youth engagement in sustainable development at all levels. I've also talked about the 17 goals. The format of the session, if there are questions, please feel free to type them into the chat. This will be picked up later on and we'll try to answer them. We are going to be using question format. We'll go around and ask the panelists questions, and then we'll take questions from the floor intermittently. So let me go right in to the first question, and I'll start by putting that to Chibuna. Chibuna, can you tell us more about what you do and how your work was impacted or not by the COVID-19? And what measures have you taken to mitigate that, if any? Because maybe you didn't experience anything, maybe you did. Would like to hear that. So over to you, Chibuna.
Okay, thank you very much for the floor. First of all, the pandemic really affected me personally because I'm still a final year student of chemical engineering at Federal University of Technology, Owerri. So when the pandemic started, they had to shut down schools and we are all told to go back to our homes. So academic activities paused in Nigeria and left everyone, locked down in their homes. So for my company, Renew Cycle, currently at the early stage of startup, we have been building our prototypes and also undergoing a lot of trainings. But due to the pandemic, our team at various states and homes in the country. But we continue to engage ourselves virtually on Zoom, on WhatsApp, and other platforms. But then we were able to also partake in the Clean Technology Hub incubation and acceleration, which was now converted to be a virtual program. So we have been in the program since May. We are still undergoing the virtual incubation with Clean Technology Hub in Nigeria. So at the end of the incubation, by October, we'll present our prototypes and also our minimum viable products at the demo day to pitch to investors and also to other audience so that they can know about our products and about what we do. So this is how the pandemic has actually affected us and how we were able to mitigate it. So what we did was that we decided to look into how we can develop ourselves as capacity building, because capacity building was now a major focus for us since we cannot engage in physical activities outside. So we had to engage in acquiring knowledge and also capacity building. So this is how we're able to mitigate the effects of the pandemic.
You are done?
Yes, I am done.
Okay. Thank you so much for that. It's interesting what you are doing, and the problem is not just specific to the education sector, even though that's very unfortunate, and I hope we'll be able to go more into that. Can I now pass on to Dr. Dixon? Can you hear me?
Yeah, I can hear you.
Okay, Kim, you're welcome.
Thank you very much. Yeah, thank you very much. And I'm sorry that I logged in a bit late. We're ready for 4 o'clock, only to realize that it's Central time. So my apologies. Okay, I'm all yours now.
Yes, so please, I already introduced you before you came. Kim is the country representative for UNFPA in Sierra Leone. And I would like you to tell us more about your work, what you're doing in Sierra Leone, what UNFPA is doing, and how COVID has impacted on you. What measures have you taken to redress that? Yes or no, yeah, that's it.
Okay, all right. So thank you very much. As BC said, I'm the UNFPA representative in Sierra Leone. In Sierra Leone, can you see me? Okay. In Sierra Leone, we are, as UNFPA, we have 3 main transformative goals, 3 goals. We're working towards 0 preventable maternal deaths, 0 unmet need for family planning, and 0 gender-based violence against women and girls. So 3 zeros is the work that UNFPA focuses on. Now, in terms of the COVID-19 pandemic, of course, it hit us, all of us, quite suddenly, and we've had many challenges. So we focus mainly in 2 areas. One is focusing on supporting the response to the COVID-19 pandemic. And then another area is focusing on supporting the continuation of our core mandate areas. So continuity of services for prevention of maternal mortality, continuity of ensuring that family planning commodities are available and services are accessible. And then we've also focused on supporting the preventing and managing gender-based violence. Now, as we all know, the COVID-19 pandemic has brought on new challenges. Challenges that include, for example, people are now even scared to go to health facilities because of the fear that they may get infected. And whether it's pregnancy and childbirth, it does not stop for the COVID-19 pandemic. We were even saying that even things like menstruation do not stop when there's a pandemic. And therefore, you can see our core mandate areas are still very important. Another thing that we have shown through estimation of data, but also previous experience from Ebola, is that during such epidemics and during lockdowns in particular, gender-based violence particularly against women and girls, increases. And therefore, we've had to ramp up our services. So what have we been doing in terms of responding and ensuring that sexual and reproductive health services continue during the pandemic? Here in Sierra Leone, in the area of reproductive health services, we quickly did an assessment of services to see, one, what are they doing around infection prevention and control? Because we don't want people to go to services and become infected. And then we also looked at what is happening. Are women still accessing the services? Our assessment showed us that infection at the time, infection and prevention and control was not so high. So we supported government, and government has also ramped up efforts to improve assessing clients as they come to the health services, to improve the awareness around COVID-19. Focusing on women in particular, as UNFPA, we did what we call pre-positioning of contraceptive commodities. So we sent out contraceptive commodities to the clinics and hospitals, because at the time we didn't even have a lockdown, but we anticipated a lockdown. And we said, well, if there's a lockdown, there'll be difficulty in us getting these commodities out to the services. That was one. In terms of pregnancy services, we've actually put together what we call mama baby packs. And these mama baby packs include essential items for women who have delivered, for themselves and for their babies. So blankets, towels, diapers, etc. And now we also included masks and sanitizers. And for all women who delivered in hospitals from the period of June, and it's still ongoing, we've given them these mama baby packs. The idea being that women will go back home to their communities. They will talk about what they got when they got to the hospital to attract other women and girls to come and deliver in hospitals. So that's one. We've also focusing specifically on marginalized, vulnerable girls. We started immediately packing what we call dignity kits. UNFPA dignity kits consist of traditionally underwear, sanitary towels, whistle, flannel, soap. Why these items? We recognize that during emergencies, women have a lot of difficulty in accessing sanitary towels, something very basic. And we put a whistle, for example, if a woman has to go out at night, you know, to either use the restroom or to change, then she may be at danger. So the whistle is something she can easily use to whistle and ask for help. And because of the COVID-19 pandemic, we've now included in our dignity kits, we've included masks and sanitizers. And we also include messages around COVID-19 and around gender-based violence and prevention. We've also supported government because of the increase in GBV to set up a hotline. And we've also been putting out messages on radio and also through a partnership with a major service provider. We're sending out messages, one, to talk about gender-based violence, what the law says, it's against the law. If you rape a woman or a girl, it's a crime. And we also direct people to the 116 hotline for where they can find help. So these are just some of the things that we've been doing here in Sierra Leone. It's in line with our usual work, but we recognize that the COVID-19 pandemic has the potential to increase gender-based violence for women and girls. It has the potential to restrict services, and therefore we have ramped up our efforts amidst the COVID-19 pandemic. So this is just some initial thoughts. Thank you.
Thank you so much, Kim, for that very comprehensive outline of the measures to help women and girls cope with the pandemic. I think I can now go to Mary. Mary, can you hear me?
Yes, BC, I can hear you.
Good. Mary, you're welcome. And sorry about the little hiccup you had there with joining the session.
Sorry, yeah, technology.
So Mary, can you quickly tell us about your work in Rwanda, what you've been doing and how your efforts have been hampered by COVID, and then what measures you've taken to safeguard and to alleviate some of the difficulties and challenges that you experienced.
Yes. Thank you, BC. Yeah, okay. Thanks so much, BC. Thank you for inviting me to be part of this conversation. My name is Mary Barikongeri, as BC just mentioned. I am the director and founder of Rwanda Women's Network. This is an organization that came into being soon after genocide against the Tutsi. And since that time, we've been operating, and now we've been around for the last 26 years. When we started to do our work, our main challenge and worry was mainly centered around women and girls. So most of the programs we do are really focused on how to address those challenges. So when we started, it was a new program, but we emerged out of an international organization where I was then working as the country director, organization known as Church World Service. So the program was mainly focusing on family to family and the economic empowering families and settling children, foster families, and empowering foster families to take care of Rwandan children. So out of that, over the years, the organization had to leave and now left the whole responsibility into the hands of Rwandans. So we had to go back to revisit the program and see how best we can begin to intervene based on where we began. So we did assessments, went through all sorts of work with the families who had taken over the children. Mainly those who volunteered to do that were women widows, survivors. And also those women who never knew where their husband had gone, had also offered to host children in their homes. So we ended up calling ourselves Rwandan Women Community Development Network. The whole purpose of that name was to make sure that we keep the community dynamics that we had started with within the families. And so the whole purpose of doing that was also to make sure that we embrace our vision of community mobilizing, organizing, and working towards social transformation. So today our work, the ultimate goal is actually social transformation. How do we rebuild a new society? How do we rebuild new families? How do we, give powers, empowerment to our women who have gone through so much? So our work is built on that. To be able to do that, we managed to start on with 5 main programs, and those were mainly around health care and support. We chose to use health care and support as an entry point because the majority of our women were gang raped, mutilated, and we wanted to bring back hope in their lives. And of course, care means caring for them and giving them support to reassure them that there is tomorrow. And beyond that program, it eventually started as a simple, mere safe space where women were narrating their stories, where women were crying. But at the end of the day, we say to them, you can't cry and go on forever like this. So we need to sit down, plan it together, execute the program that we think will be able to address our real issues. So what became the safe space eventually became a clinic, which is now supported by our Ministry of Health and Global Fund. And this mainly takes into interest the issues of women. But while we are now struggling with issues of gender equality, we made sure that we open up out to the other communities so that it truly becomes an inclusive clinic. So beyond that sort of space, we made sure that there's a program on education and knowledge sharing, because we came to realize that in the work that government was trying to promote at the time was first and foremost to look into the laws and make sure that those which were not women friendly or community friendly are changed. So we had to work towards also influencing such a change. So that made us, through our spaces, making sure that we analyze those policies, we make sure that we integrate what we think is missing and begin to advocate to our government in order to integrate the policies that we thought were women-friendly spaces. And of course, in that same logic, lots of things that emerged was the whole issue of gender-based violence, regardless whether we had gone through genocide, but we came to realize that there were so many other gender-based violence issues within the homes, even within the communities. So we started now looking at a program on prevention and response. And that way gave the women the reassurance that we who have become victims of yesterday, we also want to be dynamic and become change makers. And so our communities are driven by the same women who were victims of yesterday, and now the ones who are operating in our communities as the paralegals, as the home-based caregivers, and also as community facilitators. So they are the ones who train the communities on the legal aspects, issues, to inform the communities where to go, at times accompany them, receiving the spaces, those women who are going through gender-based violence in their homes, domestic violence. And now in the same logic, we've come to integrating into the whole area of conflict management. As you know, Rwanda being a post-conflict or post-genocide country, we still have those challenges of prisoners now moving out of prison, but to go back to the communities, and lots of challenges. So how do we then, should we address that? So we've made sure that we prepared mainly our women to really be able to take on that huge challenge of people returning back to the communities. Either husbands are back in the communities, wives have remarried, their lives have continued on. So that becomes a huge challenge. Those are the issues we are faced with as we are talking of post-prison integration of our communities. And in the same logic, as we are struggling to promote gender equality, we make sure that in such a spaces, we have also included the Men Engage, Men Care Approach program, which is built based on the women community facilitators and paralegals, and inviting the husbands now to go through the same processes that our women went through. We found that gave the women confidence to feel that they are confident enough to bring their husbands on board, other than thinking that you can bring a husband and wife on the same table, discussing domestic issues, challenges. We felt that women needed to be empowered enough to know that they have power within themselves, that they can also change situations where the situation was needed. Of course, in the same logic, we made sure that our programs of socioeconomic programs, it's all linked also to the same network of paralegals, of home-based caregivers, of our community facilitators, to make sure that they're economically empowered. And we take them through a process of financial literacy, and then lending them money, but also encouraging them to promoting tontine around themselves. And that way, they're able to stick together, they are able to develop their solidarity networks in their communities, and also begin to learn to live together as we are struggling to a new peaceful Rwanda. And of course, the governance program we have also that is promoting also leadership is to make sure that all those community-based women and men we have in our communities, they do actually understand the government programs and be able to engage at the district level and to be able to hold accountable the district. So we encourage them to participate in many government-created spaces so they can bring their voices in such a spaces. Typical example is in our districts, we have what we call the joint development forums. And in those joint development forums, we make sure that women and men in our communities represent the organization and be able to bring issues that they come across in the communities in that kind of forum, so that we begin to also bring out issues of advocacy from the district level before they eventually get to the national level. And in the same logic as a networking organization, we made sure that as issues come from below, then we also created a space of which we call the SDG 5 Forum, which helps us to bring all those community issues in the space at the national level, where we invite the central government to come and dialogue with the communities, to come and dialogue with the other civil society organizations on challenging issues that we see in our communities. And that has helped us to also be able to challenge, to talk about issues that we don't see working. As you know, at times when you have got extremely progressive systems, they intend to forget that the other people can feed in. So such a space of the SDG 5 Forum and other different spaces that are there have helped us to actually address such issues. So in that logic, we are able also to make sure that we bring our other development partners on board so that we can begin to speak a language of together as central government, development partners, and civil society. Now, when you look at the programs we've been developing, we've got several approaches, and the main approach we use is holistic intervention. And in those holistic intervention, we make sure that as we are bringing awareness to the communities, we made a strategy of having an easy way of awareness raising by creating community spaces. Rwanda is made up of 30 districts. We are currently operating in 22 districts, running safe spaces in that district that bring out issues that are really coming from home, issues in the communities, and eventually getting to the district forums and eventually to the national forums. And of course, we emphasize so much around voluntary community participation so that people can begin to see the importance of their participation as a way to get into leadership positions in their community level. Now, since the COVID came, one of the major challenges was definitely how we are going to be able to keep up with our community-based partners. It was extremely challenging, and we had to devise ways, and thanks to our many development partners who actually did buy in our strategy of beginning to bring the communities into the digital world. So what we've done, we've trained them on how to use cell phones so that when they go to the communities, they're able even to record, they're able to go home to home to be able to talk to the communities in order for us to know what's happening. And then we put them all on WhatsApp group. And that WhatsApp group has become very powerful and has helped us really to know that communities too can be digitally able to do things. So with that, we've been able to get several cell phones where we had to rework around our projects, and the donors were very flexible. They allowed us to change certain things and to make sure that for our community leaders, for our women facilitators, for our home-based care members, for our paralegal members, are all given smartphones that allow them to work and that able to keep us connected with them. And that has helped us to do an assessment, to be able to really understand how the communities are doing, and to know what are the challenges, and eventually work together with them on WhatsApps, what should be the solution to those challenges. So that has helped us to continue planning and executing together with the communities. Maybe I can stop there, the rest I'll leave it for the questions when it is time to ask questions. Thank you.
Thank you so much, Mary, for that very enlightening presentation. I'm actually very impressed, and I find it very intriguing that you were able to shift, very quickly to digital technology, because cell phones are very common and almost everybody has one. So now being able to utilize that to get your program going, I think it's something worthy to be commended. I don't know if we should take questions now before we move on to the other presenters. I see a lot of questions here. Yeah, I think I would open up, briefly for questions. The floor is open. Questions, I see a lot of them here. I don't want to read them. I want people to, come up and, talk. By show of hands, if you have any questions for the presenters. Okay. In that case, I think I will read them at the end of the meeting. Can I now go on to Chibuna? Chibuna has a PowerPoint presentation on youth engagement. We mustn't forget what today is all about. It's all about the youth. So let's hear from Chibuna what he's doing and how is somebody has a question. Okay, I can't see the hands. Please unmute yourself and ask your question.
Hello, this is Can you hear me?
Yes, we can hear you.
Thank you, first of all, Bissy, for inviting in this very important webinar that in this, especially in this challenging times. And I was very interested in the previous presentation by Miss Mary, and I just wondered, they had found the solutions, and for how long this project is going on. That's one, because it must have gone step by step. And how did she, the organization, actually get a buy-in from the Ministry of Health, number one, and from the community, in the men in the community, and also the older people in the community. How did it would be very interesting to know, because many people would like to maybe learn from that lessons and experience, and it would be nice to just hear how did it happen, because very rarely we try to do things, but the Ministries of Health and their policies actually in the country do not support. So it just becomes a standalone program. Thank you.
Thank you, Mina. I think that question was for Mary. Mary, would you like to answer now?
Thank you, Mina. Thank you, Mina, for your question. I think the question of buying into the Ministry of Health, you know, Rwanda has gone through lots, and mainly around issues of violence against women, especially during genocide. And that has become a lesson for them to know that this is an issue they just can't address alone. So really they had to invite civil society. And so what we brought in on the table that has actually fascinated them was to see how we are creative enough as women to talk about spaces where we feel safe, where we feel not being judged, and able to say we want to plan our life according to what we think is right for us. And that became extremely overwhelming. And that's why in my work, I really keep saying that if we are talking about empowerment of women, we need to begin there. We need to make them feel cared for. We need to make them know that they are capable. Because oftentimes we are portrayed as victims. So in a sense, we came to realize that by giving women such a spaces, it's going to give every woman, no matter from whichever country you come from, opportunity to think, interrogate, and be able to question what you think has not worked. And I'm seeing this in my own country. So please, let's promote safe spaces. And I don't even call them spaces, but safe, because that's safety of women we are talking about. And in that safety, we are talking about a lot of things. We are talking about their healing. We are talking about promoting solidarity. We are talking about understanding the homes and the lives we live in day to day, the inequalities that we suffer, and begin to say, what can we do to address it? Once these very many rural women get to understand the equation around inequalities, believe me, it is a awakening call for them. So, and I think when the Ministry of Health could not address the issues of violence against women, especially domestic violence, they found that this is a program that can be very helpful. And thank God, at the time, Global Fund even chipped in to support our work. And of course, once an outside chips in, there is also an interest for the government to want to understand what is this? Because beyond having those safe spaces, we even went as far as of creating villages of hope. And I think those are very important. So for me, for Ministry of Health buying in, I think once a program works well, they have no choice but to honor what you're doing. And all I think they do is to make sure that your program is also integrated in the other health centers. But we, of course, ours becomes precious because we bring in value added. Pardon? Hello?
Yes, go ahead, Mary.
Yeah, so that's really, so there's another question Mina asked about men in the communities. You know, Rwanda, there is a move and there's a drive of promoting gender equality. You know that we have the highest number in parliament. So there is
the government-driven one.
Yes. So with that, men are starting to feel that we are given much more opportunity. We are paid a lot of attention is paid to us, and all sorts of. So we are realizing that we need to be very careful not to have a backlash at the end of the day. And of course, we came to realize that when we were creating the safe spaces in the communities, men started claiming that why aren't we involved in these safe spaces? And quickly the women said, organize yourselves. And you all agree with me that anywhere in this world, people who first organize around any issue are women. Now, gradually, I think men are also starting to say, let's organize, let's eventually ask to be part of the whole process. So I think that's where Rwanda is. And that's why we have integrated in our spaces the men care program, to really show them the importance of men caring in promoting the gender equality beginning from our homes. So that's how I could answer you, Mina, on this whole question of men. We did not want to make sure that there is a backlash. So we said, let's start engaging them, but bring them in the spaces we have created ourselves so that you are able to maintain, because we don't want dominance. And you know what dominance can do. So that's what our strategy has been: women empowerment and gender equality at the end of the day. Thank you.
Thank you so much, Mary. I have a question myself before we move on to our other panelists. And this is on cost, affordability of the safe spaces. I think we'll leave that to the end so that you don't go into that now, but have that at the back of your mind that when you come back, address the issue of cost, whether you charge for the use of the safe spaces, or I know you said you have funding and all that. Let me now move on to Chibuna. Thank you so much, Mary. That was very enlightening. Let me move on to Chibuna, who has a PowerPoint presentation for us on youth engagement for global action. We can't hear you, Chibuna. Are you talking? Hello, Chibuna.
Chibuna needs to unmute.
Okay. Thank you. Sorry. Yeah, good evening, everybody from Nigeria. And I'm very delighted to be here once again. So I'm going to be sharing my slides. I was a participant at the first Arena Youth Forum in Abu Dhabi in January. And that was my first platform where I was able to engage at a global level, representing Nigeria at the Arena Youth Forum. Currently, I'm also the Sub-Saharan Africa Regional Coordinator for the Global Youth Energy Outlook. Okay. Okay, so my introduction is this. Africa's population as a whole is very young, with about 60% of the entire continent aged below 25, making us the youngest continent in the world in relation to our population makeup. Is this a threat or an opportunity? This question is what I want all of us to have in mind, okay? And being today the International Youth Day, I'm sharing our work at RenewCycle. So RenewCycle is a high-growth renewable energy startup based in Nigeria, and our work is to promote the access of electricity through renewable energy. Here you have us pitching our prototype at the Student Innovation Challenge in Abuja last year, and here is one of our customers undergoing the testing of our MVP. Our work during COVID-19. So we carried out a community-based needs assessment, because as a profit company, the pandemic actually forestalled every other operation. So we had to look inwards and now started community needs assessment in Okaigankwegu community in Umuahia, that's in southeastern Nigeria. And we discovered that the local health clinic in the southeastern Nigeria in Umuahia did not have access to electricity. More so, they had a very bad bathroom for where the women who deliver their children have their bath. So we decided to launch the Social Impact Fund, which is $100,000 target commitment to be raised in order to help these community health clinics to access affordable and clean electricity with the help of partners and our company as well. And we also launched the Light Up Nigeria initiative, which our project seeks to power 10,000 local clinics in 5 years. Moving on to introducing the Global Youth Energy Outlook. So earlier in May, I registered for this competition, and we were selected amongst other participants. 12 participants were selected, and then we had the Global Youth Energy Outlook regional coordinators from all regions of the world. So I'm representing Sub-Saharan Africa, and our goal for the Global Youth Energy Outlook is to reach 50,000 youth aged between the age of 18 to 30 years old across the globe with the Global Youth Energy Outlook questionnaire. And our aim is also to bridge the gaps between youth and governments, businesses and institutions. And this will be the first document that discloses what today's youth wants for the sustainable energy transition. Also, we are trying to use this to influence a just, equitable, inclusive, and sustainable energy transition from the youth perspective. And we'll be very glad to welcome partners and also organizations in Sub-Saharan Africa who would like to participate and help us to share the Global Youth Energy Outlook questionnaire at the end of my presentation.
Thank you so much, Chibuna. Yeah, that is really commendable, and I really appreciate your energy and all that you are doing to light up your communities. I think lighting up Nigeria is a tall order for now, but I mean, to eat an elephant, you have to do it in chunks. So we can now move on to hear from Honorable Gloria on NEPA.
Before we go to Gloria, can we ask Chinedu some question?
Okay, very briefly, I think we can take that.
Okay. So thank you everyone for BC for these great initiatives, and this is very good. Collaborating and bringing everyone together. And I've listened to all the speakers, but Chinedu, initially I asked you a question about your MVP, right? Very good presentation, and very good initiatives, right? But my question to you is, are you focusing on the areas where there are no power in Nigeria? And that's number one. Number two, how are you working with the federal government to be able to connect your power to the national grid? Or are you allowed to work independently without linking your power to the national grid? And number three, you talk about your MVP, which is the minimum viable product. Minimum viable product is something that gives value quickly to any project we're working on. How do we create a value in a very short incremental basis using the agile initiatives, right? So I wanted to find out, what is your MVP? I've been hearing about MVP, but you need to be specific to let us know what your MVP is all about. Thank you.
Okay, thank you very much for that question. Let me start with the MVP, because I think that's one of the ones that has been really disturbing. So, okay, our MVP is a transformerless solar-powered inverter and also lithium-ion battery, looking at trying to ensure that we reduce the cost of accessing our products, because solar home systems and many decentralized renewable energy systems are quite expensive for the target audience that we are looking to capture. That's our target market: college students, young professionals, micro enterprises, rural families, and local health centers in Nigeria. So for the second question that you asked about where we work, either are we working with peri-urban areas or just rural areas? For our commercial products, that's for the MVP I talked about, we are targeting young professionals in cities and also in peri-urban areas and students as well. But for our social impact fund, which is a kind of, let's say, a humanitarian approach to mitigate the effects of the COVID-19 pandemic in rural areas, we are looking at empowering local health centers using our solar home systems and also with partner organizations. So for the national grid, connecting to national grid, we are not actually looking at connecting with national grid, because we are completely renewable, decentralized renewable energy. For decentralized renewable energy systems, you don't really need to be connected to national grid. So we're looking at those communities, those last mile communities, those people that do not have access to electricity, or those people that do not have less than 4 hours of electricity per day in their homes. So we're looking at that target market, and that's what we are doing. Thank you.
Thank you so much, Chibuna and Ibrahim, for that question. We have somebody, there's a question here, and the person is leaving. Dr. Siogu, are you still around?
Yes, I am.
Yes, she has a very interesting question, and I thought we could take that before you run off.
That will be excellent. BC, it's really great to see you, and thanks for putting all of this together. Yes, Africa is a very young continent, but in carrying everybody along for our continent to really be sustainable, we need to find space for everyone. Yeah. So the idea is that we do not leave anyone behind. So my question to Dr. Dixon is, I wonder what interventions you have for older adults, older persons, as we all grapple with this pandemic. We know that older adults are the ones who are at a higher risk of having more severe COVID-19 infection, and in fact also more at risk of poorer outcomes. So that's one issue. The other issue is that as we are dealing with infectious diseases on the continent, we're also being burdened with the NCD load, the non-communicable diseases. So diabetes, hypertension, heart diseases, respiratory diseases. And we know that older persons actually have very poor outcomes from all of this. So it's we might want to call it a double whammy for being an older person in this season of this pandemic. And I wonder what your interventions are for that. And also for Mary, you're doing a great job. And it looks like you have a lot of hands-on at the grassroots level. And on the continent, most of our older adults, older persons are rural dwellers. And again, I wonder what it is you've been able to do for them to cope with this season. Thank you.
Before I let you go, and before Mary and Kim answer your question, Dr. Gugwa Osiobu is the, are you the coordinator of, you are the head of the geriatric department at the National Hospital in Abuja?
Yes, that's correct.
I know you have a lot of older, elderly yourselves that you,
as patients, yes.
Yes. So what, from your experience, what would you say was, the main challenge, and for yourself as a service provider, and then for the older persons themselves? I know Nigeria is not like in Europe where we have them in residential homes and it's so easy to, take care of them. Even despite that, you find that most of the mortality cases that we had were from the homes. The case of Nigeria, older people are in their own personal, individual homes. But as a service provider, what did you people do? What strategies did you put in place? How did you manage? Is there an increase in the cases and,
All right, so it's been very challenging. So of course, at the onset, there was a total lockdown, which meant that patients could not show up for their appointments. And what we had done at my center was to send out text messages to say, to give them an alternative platform to engage with their physicians. So we provided a telephone number that we were able to use WhatsApp platform to continue to engage during that complete lockdown. Of course, those who had strict emergencies could come in because emergency vehicles that had people who required emergency care were allowed to move. So that was one thing that we scaled up using social media to be able to provide video conferencing, video consultations. We could refer them to pharmacies that were nearby for them to retrieve their prescriptions. But I must say that even after the easing of the lockdown, the fear of acquiring COVID-19 infection stopped a lot of the patients even from coming into the clinic. So I actually got one of them call me last week. She has not moved out of her house since this pandemic. She's afraid to come to my hospital because we have in my facility an area where we're treating COVID-19 cases. So they're fearful of coming through for their care. So our numbers have reduced significantly, and not just for the geriatric clinic, it's across all of the clinics. A very important group of persons that we must bring to the fore are those who are suffering from cancers. They again form a very high-risk group who could have very severe COVID-19 or actually die from COVID-19. If they need radiotherapy services and cannot get to it, it brings about a disruption in their care, and it could bring about poor outcomes just from the cancer alone, even without them contracting COVID-19. So it's a challenging time for both service providers, for us to continue to provide the care that we love to, we know how to do, and for our clients. As a member of the Geriatric Association of Nigeria, we have collaborated with the Nigerian Television Authority to do a TV jingle, raising awareness for older adults, just for them to know what to do during the season so as to beat COVID-19, so that they do not contract the infection, ensuring that they're complying with all of the restrictions. We did that in English and in the Pidgin language, just to be able to reach as many people as possible. We've also been doing a lot of webinars just to raise awareness for other clinicians who are not geriatricians, who might have to now fill in the gap, either in the private sector or primary and secondary health services to know how to manage this also, who are not able to come to us as their consultants at this time. Hello, BC, are you there?
You're muted, BC.
So thank you so much, Ogugwa. I was asking, would you say that you had an onslaught in increased number of your cases, or there was no difference, or
significant reduction because they're not coming. So they're not coming physically, or we're able to interface with them using social media platform for those who want that service.
Okay, all right. Indeed, SDGs is about leaving no one behind, and it cuts across life cycle, not just women, of any particular age group. Right. It goes on to the elderly as well. Thank you so much. At the end of the meeting, I'm sure we'll be able to hear from Kim, because your question was to Kim and Mary.
Mary, yes.
About how they handled older persons. Right. So I will take those questions afterwards. Kim and Mary, please take notes. I would now like to go on to Princess. In my language, we have a popular saying that the biggest masquerade dances last. So this is Africa Union we're talking about, NEPAD. She's not going to be speaking on behalf of the entire continent because she's the national coordinator for Nigeria, but whatever actions, activities are of course influenced by what the regional body itself has put in place. So over to you now, Princess. Can you hear me?
Yes, please. Can you hear me?
Yes. Yes, we can hear you.
Thank you very much, BC. Thank you for inviting me. I appreciate the invitation and participation so much, especially this time that we really need our experience sharing and the wealth of knowledge to enhance our activities. I welcome all of us, most especially the panelists, Dr. Kim Eva, Miss Mary, Chibunna Obonna, who spoke greatly on renewable energy. I'm going to come to you again for so many questions and probably possibility of collaboration. Thank you very much for having me. Before I start, I want to give a little background of what NEPAD is and what we do so that we can understand the organization and maybe some opportunities of collaboration and what is going on in Nigeria and continent at large through this vehicle. It's a small presentation, but probably I will share it after now. It is my great pleasure to welcome all of us to this important and valuable training, while appreciating technology as a global tool of communication as a result of COVID-19 restrictions. I would like to appreciate organizers of this program in making sure that the best is utilized out of the present challenges posed by COVID-19. In different areas of life, and ensure the delivering of the Sustainable Development Goals, SDG 2030. I am specifically grateful to Dr. Adebisi, the moderator, for her efforts in ensuring the reality of the program, and to my fellow panelists and participants for their wonderful time and contribution so far. As we all are aware, the new Partnership for Africa's Development emanated from a mandate given to the 5 initiating heads of state: Algeria, Egypt, Nigeria, Senegal, and South Africa. To do what? It was given by the then Organization of African Union, and now is African Union. NEPAD is initiated as an integrated socio-economic development framework for Africa. The 37th Summit of AU in July 2001 formally adopted NEPAD, New Partnership for Africa's Development, as a vision for socio-economic development of Africa and a policy framework to address the twin issues of underdevelopment and marginalization of our dear continent in the competitive and globalization world economic environment. In the process of delivery, NEPAD is mandated to identify and work with key partners in the public and private sector, as well as the civil societies. The civil society and international organizations to facilitate, promote, and monitor the implementation of the organization with mandate to implement African Union flagship programs at the country level, at the member states level, at the community, state and community level. And what is the assignment given to us is to eradicate poverty, to place our countries, both individually and collectively, on a path of sustainable growth and development, like the outlined goals of the SDGs. Halt the marginalization of Africa in the globalization process, and enhance its full beneficial integration into the global economy. Accelerate the empowerment of women and youth. That's why I cherish my co-speakers and participants for honoring this wonderful program, and the speakers who has also spoken well on the importance of women development as well as youth. The UN Resolution 57.7 urges African countries to establish African country offices with the responsibility to facilitate, monitor, and implement NEPAD programs. Thus, the establishment of NEPAD Nigeria in 2003, with a mandate to promote and develop programs that can enhance the lives of citizens, especially the women and the youth, more especially at the rural level. In committing member states in implementing the SDGs, AU Agenda 2063, African peer review mechanism was designed as a flagship program of AUDA NEPAD, that's African Union Development Agency NEPAD, for effective implementation of the mandate as a self-monitoring and assessment tool, voluntarily acceded by member states for enthronement of good governance. Because everything we're discussing here is geared to good governance, quality leadership. In our continent, with the expanded mandate to track, monitor, and assess the impact of the implementation of African Union Agenda 2063 and the SDGs, UN Agenda 2030 on socio-economic development, as well as to provide quality leadership. However, the primary objective of APRM is to foster adoption of policies, standards, and practices that lead to political stability, high economic growth, sustainable development, and accelerated regional and continental economic integration. This could be achieved through experience sharing like we're doing now, reinforcement of successful best practices, including identifying deficiencies and assessment of requirements for capacity building and quality governance. African peer review mechanism exists with a mandate to encourage the participating states in ensuring that their policies and practices conform to the agreed political, economic, and corporate governance values, codes and standards, and to achieve mutual agreement objective in socio-economic development as contained in NEPAD Declaration on Democracy, Political, Economic, and Corporate Governance, which form the nucleus of good governance. The mechanism activities are championed through the 4 thematic areas as follows: democracy and political governance, economic management and governance, corporate governance, socio-economic development. The agency is in actualization of the SDGs, Agenda 2030 and 2063 is mandated to coordinate and implement priority continental programs, continental and regional projects towards promotion of regional integration that will accelerate realization of Agenda 2063. Strengthen capacity of AU member states, capacity of Nigeria, as example, and regional bodies to design, plan, and implement Africa's priority development programs like the renewable energy within the framework of African Union Agenda 2063. We're also mandated to provide knowledge-based and technical advisory support. For example, someone asked a question, if the, is it Obonna, the renewable energy presenter, if he's discussing with the federal government, NEPAD is designed as a tool or a vehicle to link up with your program with the federal government agenda and be able to monitor it to ensure implementation and results oriented at the end of the day. So it's a tool, it's a PPP platform poised to prosperity, poised to development, to achieve the SDGs mandates in summary. So we are to provide knowledge-based and technical advisory support to our heads of states and government, to our government, undertake full range of resource mobilization in collaboration with our development partners, serve as the continent technical interface with all Africa's development stakeholders and development partners, while reiterating the agency's commitment in effective and accelerated development across the country. Please be assured that we can all work together to get this. But I have to put to your notice again, the core principles of NEPAD, which is good governance as a basic requirement for peace, security, and sustainable political and socio-economic development. African ownership and leadership, as well as broad and deep participation by all sectors of society. Anchoring the development of Africa on its resources and resourcefulness of its people, meaning that we all need each other. All of us need to work together. It's a teamwork to develop our continent. Like our moderator said, following the SDGs goals, both on health, education, on power, on infrastructure, on capacity building, on empowerment, all is for us to work together to pool our resources and our ideas together for our development, for development of our continent. Partnership between us among Africans, because we need to believe in ourselves, we need to trust ourselves, especially this era where we have a very challenging period. The pandemic has opened our eyes. The pandemic has made us to discover whom we are, what we can. For example, the pandemic has locked down the shores, the borders of our country or even continent. No more importation, goods were not coming, we're locked up in the house, we're leveraging on our own products to be able to feed ourselves and run our lives. Like my sister that made presentation on the sanitary wares, I want to believe that most shops at some point does not even have stock to buy. So it has made us to rediscover ourselves. Who are we and what are we doing? What do we need to do to change our scenario, believe in ourselves, be able to produce for ourselves, work for ourselves, and govern ourselves in a more robust and enabling manner that can accommodate us in our own country without looking outside so much. Building the competitiveness of African countries and the continent. Forging new international partnership that changes the unequal relationship between Africa and the development world. Ensuring that all partnership with NEPAD are linked to sustainable development goals and other agreed development goals and targets. So this is whom we are, and this is our objective, this is what we do, this is how we link up, and this is how we run our activities in our dear country, Nigeria, and continent at large, because it's linked with member states. We all carry each other along. So looking at the problem of this COVID-19, yes, we came in and we saw looking at the mandate of NEPAD is poised for development and economic growth. It's a vehicle for job creation. It's a vehicle for wealth creation. It's a vehicle for internal development. It's a vehicle for experience sharing, where we put our experience together and be able to come up with policies and programs or projects that can enhance our development and economic growth, both in our country and our continent at large. So we come up with a 4R to drive this as an organization, which is to reposition, realign, restructure, and relaunch. And to do this, we started with capacity building, because you have to understand your objective, your mission, your vision, and your set goal, and how to realize it. We reestablished the structure to suit today's world, so to speak, because this is the new era of technology, the new era of trying to do things on our own, probably, especially this period of COVID-19, to identify our critical stakeholders, both at the private sector and public sector, be able to integrate and then put up a roadmap where we can meet each other and be able to add reasonable value to our country's development. Design the operational model, the system, the mechanism, or the method, how we can all work together and achieve results at the end of the day. So we've been able to do all this, and we've also launched out both internally and outside. So looking at the year 2020 and the year of, and today is the Youth Day. And what do we need to talk about the year, which in our AU calendar is the year of silencing the guns, AU Agenda 2020. The year we said enough to youth restiveness, enough to youth unemployment, enough to youth not believing in our youth, or maybe I don't want to use the word radicalism. You know, the year will say, let's live in peace. Let's cherish one another. Let's come together and be able to approach our challenges and proffer solutions to numerous of them that is hampering on the development and the growth of our country and the continent at large. So what are we doing? We launch a program on peace and security with the security of the country, which we had our African leaders and stakeholders in attendance, bringing the youth together. I'm happy to meet another brilliant youth today, Chibunna, and many of them that are listening to us. So we brought them together to say, what do we do? How do we work it out? And if you look at it, the way to go, number one, we must realign the energy of our youth. We must reposition the understanding of our youth. And we also need to create the enabling environment with the necessary requisites: access to funding, to soft loan, access to mechanized agriculture, access to good health, to water, what I call bottom-top approach, addressing numerous challenges at the community level, like this young man said. When he said light up Nigeria, he's right, because if the renewable energy is also part of our project, which I'm going to talk about, our community renewable project, to empower the youth, to create the enabling environment at the community level for development and economic growth. Because we want to believe that if the youth are properly engaged, which is the pride of every nation, youth are pride of every nation, women are pride of every nation. There's no youth that will watch the mother starving and dying and will be happy. Most times it's a challenge to the youth that makes them go resting. So what we need to do is understand the language of the youth, align them with the leadership and the leadership and the mechanism, the leadership or the development mechanism, tap into their energy and their own innovations, and be able to integrate them into the development plan of the country, engage them to do it themselves. For example, we don't need to do construction and go to bring people outside to do that. We have our talented youth graduates that we can take. I have a colleague in Sierra Leone who is already implementing that. Nigeria is also implementing that, because the Minister of Works, if you follow the agenda of this present administration in Nigeria, it started with change mantra, and then under the change mantra, you have zero tolerance to corruption, you have job creation, employment of youths, you have diversification of economy via agriculture, and you have infrastructural development. So when you put all this together, it's geared towards job creation, wealth and job creation. So that is realigning the youth. So all we need to do at this point, especially today is the day of the youth, that youth need to realize that without peaceful environment, development will not take place. And we need this partnership. Thank God the organization is a partnership for development. So the youth need to realign themselves, make it easy for government to identify them. Like as I've identified today, I want to promise this meeting that I'm going to work with Chibunna to see how we can meet and be able to integrate his project into the national program of action, which is what government is looking for at all levels. So what I'm trying to say here is, when the youth organize and galvanize themselves with a meaningful direction, a meaningful proposal, it's easier for government, the leadership, to embrace them and integrate them into their development plan. So this is to say that the youth in Nigeria has very huge opportunity, because I want to say that Africa is still a virgin. It's untapped, untapped potentials, untapped resources, very much virgin, that every development is the next destination for the world. I'm just trying to summarize a whole lot. It's the next destination for the world. And you know that the world, the Asians, the Europeans, they're all coming into Africa to seek for partnership, to seek for investment and all that. And that is why I say that the youth need to galvanize themselves amid COVID-19, what the challenges is all about. For example, look at before, this meeting would have been an invitation to fly into Geneva or somewhere to host this summit. But today, the pandemic has made us to rediscover that we can as well hold these meetings through virtual without making a move, and we still see each other, appreciate each other, brainstorm with each other, and make success out of it. So these are the new innovations that is going on that the pandemic has made us to discover. And at the same time, for us here in NEPAD, we have also designed a program to address the challenges of COVID, of this pandemic. And what have we done? We have introduced the 3 Ps. We call it productivity, to ensure that all the resourceful contacts, like all of us that we've met ourselves here, including development partners, are utilized. We come together, are brought together to be able to add value to our mandate and then to the development of our country, because NEPAD is poised for development and economic growth. So we must tap all the contacts, all the necessary and relevant assets that we need to embrace to ensure that we make success. One of it, which is meeting you today, getting more knowledge and more information from you, getting your ideas, what you intend and what you are doing, and where we need to align it to what we're doing, which is part of it. Opening our door for PPP, public-private partnership, for development and economic growth. And another one is, we call it a partnership. So the partnership is coming up, like, for example, your proposal, what you think you're doing, what you think the government needs to know, what you think the government needs to integrate into their national program of action, and be able to utilize it, work with you for the same purpose of development. And then another one is prosperity, shared prosperity. The pandemic has brought down a lot of hardship, especially at the rural areas. To the women, to the youth, every person is feeling the bite. It affected our economy seriously. Business are not driving like before. Insecurity is on the increase. Restiveness is on the increase. So we need to think out of the box. What do we do? How do we ensure that we revalidate what needs to be done? We need how to bring in what that can cushion a process, a mechanism, a procedure that can cushion the effect of COVID-19 on all these I've mentioned, and be able to grow our economy back and bring back the normal life that everybody is enjoying. Then, in a way to get this done, no doubt that pandemic has locked us in. No doubt that pandemic has made us not to visit one another. No doubt that pandemic has made us not to sit as a team, brainstorm, but thank God for technology. Work is still going on. Yes, the psychological effect is there, but we are getting the healing gradually. And during the pandemic, we were able to use our organization to launch out via media, social media, to do a lot of awareness program on the safety caution and the guideline, safety guideline of the pandemic. And NEPAD having a very good structure. We have the NGC members, we have the zonal government council members, we have the state coordinators, we have focal points at the local government, and we have focal points at the ministries, we have the CSO. So we have our network to be able to route our programs to the communities and to the public and private sectors. So we were able to put up these key programs. The innovative strengthening of smallholders, farmers' capabilities. What this means is that this administration has identified a way to grow economy, create jobs, and share prosperity among Nigerians. And we have to key into the vision. And the vision of diversification of economy via agriculture, putting our eyes a little bit off from the oil, and then creating a new channel of resource mobilization. So we try to engage, design a program that will engage the communities. Our program is going to be community development based, because we want to believe, we believe that if you get community right with all the amenities, you don't need to have the urban areas congested. Development will drive from the communities, prosperity will drive from the communities, and people will the dwellers will be happy where they are. It will minimize insecurity, and it will also create a lot of jobs at the community level. We don't need to see our university graduates graduate and come to the city to look for what to do, white collar job. It will enable the community, the youths and the women, create their own environment, run their own environment successfully with a whole lot of wealth and enabling environment. And it will also help them to link up with the national, with the government, what government is doing. And that is why we have created this. This means that we are going to do land treatment and reclamation for the farmers. We are also going to put them in clusters like cooperative form, help them to access soft loans, and be able to work with the state and local government to create wealth at the community level, whereby there will be food processing and packaging for export and all that, whereby that the local farmers will be trained on mechanized agriculture and the use of technology, especially using the renewable energy to light up their farms, light up their communities, and as well as their cottage industry, to run their cottage industries and all that. And we also have this project of Feed Nigeria. Feed Nigeria, we're focusing on cassava.
Princess, can I interrupt you?
Yes, please.
Yes, seeing that today is International Youth Day, and we've also heard from Chibuna that, you know, schools have been closed. We all know this. And this is not just in Nigeria, it's across the world. For some countries, they've been able to step up and put strategies in place whereby education continued online. For Nigerian federal universities, I don't think that's the case. I know the private universities did that. The private secondary schools did that as well. And now I'm putting it to you. What has NEPAD been able to do? You know, you gave us this very beautiful presentation on how you are aligning and how the youth, their voices are to be heard, how you've incorporated them and their projects into what you are doing. Now, with the challenges presented by COVID-19, a whole semester has been lost. And I don't know how, you know, what strategies are you thinking of or that you've been able to put in place to redress this? How can we ensure that the young people, we don't lose them totally, we don't lose their voice, we don't lose their contribution, because they have a lot, we saw from Chibuna, they have a lot in their offering, they have a lot that they are doing in their individual spaces. How do you plan to, you know, put this on board?
Anyway, that's exactly what I'm presenting to you, because we have created innovative programs that can engage the youths. From the Ministry of Education, we all know that the challenge has been the pandemic. And I think the government wants to save the life first before talking any other. And the students have been learning online, both the university and the secondary, even the primary section, they've all been studying online. And what we try to do in NEPAD is to create community programs that can engage them meaningfully. Because this innovative agricultural project is going to be domiciled at the universities. The reason being that we don't want it to start and end and become a history. We want it to be a learning process for the young people, where they can see agriculture as a business, as a way of life, not just the normal system of going to farm like our parents did. So we are putting in a whole lot in partnership with federal government and development partners to see how we can start this innovation and launch it around, domesticate it at the university level, launch it that the youths of Nigeria, we own it, whereby you don't wait. If there is a challenge here, you can think out of the box as, okay, I engage myself in doing this. But the pandemic will not be forever like all of us pray. Does not mean they will not go back to school and get their education, which is very important. But this should be a way of life that not just going to classroom to read and write. There should be another technical way of engaging themselves to be more result-oriented, create their own wealth and be able to carry out their own, handle their own challenges on their own. So Alda NEPA, African Union Development Agency, NEPA, Nigeria, has designed this program, and we are going to launch it in collaboration with Ministry of Education, Ministry of Agriculture, the federal government, the private sector, and the civil societies. And it's going to be a whole lot of campaign for the youth of Nigeria to own up this way, this particular design program. And we have the renewable energy attached to it. That's why I'm happy to meet him as well, because we are looking at bringing together the innovation of the youths of Nigeria, extract the ones we can get out of it, and then be able to get the government buy-in into it, establish them to be able to stand in the position to carry other youths along. And the only way to do it is incorporate it into educational system so that it becomes a way of life instead of looking at it as normal, the way it will come and go. So this is what Nigerian NEPA is doing. And again, we have embarked on aggressive advocacy on the need for the Nigerian youths and women to stay safe and at the same time to be focused pursuing their dreams.
Okay.
Thank you.
Thank you so much, Princess. I think I can ask some of our presenters, our panelists, the same question now. Mary, Kim, if you would like to, tell us how, this is a problem but in particular, what can we do? How can we now ensure that the voices of our youth are not heard, are not subsumed by, by politics, not subsumed by what is going on around them now, especially in this period where we are. The challenges presented by COVID is enormous, and we cannot deny that. And moving forward, I think this is, because this is unexpected. Nobody envisaged that schools will be closed for so long, and that there will be no avenue for people to learn. So what do you think we can do moving forward? What strategies in terms of your program, Kim and Mary? How do you see us moving forward?
Yeah, thanks, Bisi. Before I talk of how I see us moving forward, especially with our youth, there are two questions that were put to me. One of them was by you, when you are talking about affordability.
We have 10 minutes left for the meeting, and I still want to go around people with questions. So I'll just give you 3 minutes to answer that.
Okay.
Thank you.
The question you asked around affordability of the spaces. Remember when we talked about bringing communities together and using a voluntary community participation strategy has extremely been very helpful. And the political message of our country, I think, has also contributed so much. Remember, we're in the post-genocide reconstruction in Rwanda. And the key message that it keeps coming from the political leadership is you have been once abandoned. Work towards your sustainability. That message is so powerful to hear from leaders. So when we go to communities, I think that somehow helps us because we keep reminding people about the long-term survival of your own children, of your own self. So I could answer that one of affordability that way. And another thing, BC, that has helped me. The women of this world are fantastic. Most safe spaces are run by women, are supported women, women to women supporting each other with meager resources, simple things. As they visit to show up their solidarity, they come with the ideas, they come with the love, they come with the compassion, and that's a very powerful thing to see. And that in itself can be sustainable, can lead such a space to sustainability. And that, by the way, has led most of our women even creating their own homes as safe spaces in their communities. So we don't pay anybody's rent. It's solidarity built within us to make sure that we survive. That's how I could answer about affordability. So my strong message to that is encouragement of voluntary spirit. In any case, really Africans, we are, I think, born in nature with that, despite all these challenges that we have faced, over the past years.
Thank you.
The older person's question around this COVID, to be honest, it's a challenge. It's a big challenge. But what has helped us and what we are trying to build in as a new strategy is that over the past, we had created a caregivers network around HIV and AIDS. And since that network has been there, we have tried now to integrate it into the whole COVID challenges to make sure that even older people are cared for, are followed up by few people in the communities, like showing them on how to distancing, masking, taking masks to the older people. And all this is again in the whole spirit of volunteerism. So the last question, on how can we ensure our youth is heard? To be very honest, one of the biggest challenges, I think Princess Vunepad, I think, alluded to it, about realigning. I think the most key thing is the political commitment of our leaderships. Once there is a political will, I think that's already a stepping stone to begin to attract the youth, to know that if they show their talent, they'll be picked up as the way as we go to build the future of different nations. So for me, leadership is key. And again, for leadership, we must understand that our youth are very challenged between the cultural context that they live in and the modernization of the society we are in. We need to insist on understanding who we are, the African context, the African values, to ensure that despite in this modernization, we need to embrace who we are.
Mary, somebody asked a question here. How are you embracing the youth? What are you doing to enhance them? Because you've talked a lot about women.
You know, the embracing of the youth I've been talking about, we have got a huge program of the girls we call girl champions. Because for us, everything starts with women, to really build in power, confidence in our women before we can bring in anybody to dominate us. So the girl champions are taking forward the youth integration, especially where we're also bringing them in the space to bring out the intergenerational challenges. Issues of intergeneration are huge, and we need to pay attention to those. Much as we believe in our culture, cultural norms, challenges are there. But if we don't begin to discuss those issues and address them and show the challenges that modernization is bringing to us, while we want to maintain our Africanness, for me, it's so critical. And I think that's where the conversation needs to go. And I'm glad NEPAD is looking on how to realign and to re-energize the youth of our continent. The intergenerational language discussion must take on. We might have all the goodwills or the policies great from the global level, from the continental level. But if we don't take back our roots, who we are, I think we will be soon have no Africa values remained to embrace. So that's my contribution to that. And let me stop here because I think others also need to make a contribution.
Okay, thank you so much, Mary. Chibuna had something to say and he was having power issues. I don't know if he's still online or he's off. Chibuna, are you still around? I wanted to ask him what he thinks, what their needs are and what can be done. I think I can move on to Mary, to Kim now. Kim.
Okay, let me come in quickly because I need to go off. So thank you very much. I just want to remind everyone that we are UNFPA. We are the UN Sexual and Reproductive Health and Rights Agency. Our focus is on women and girls, regardless of age. So we focus on women and then we focus on young girls. Now, today being International Youth Day, let me focus on what we've been doing especially with young people amidst the COVID-19 epidemic. So I'll just give you maybe 3 things that we've been doing because there's lots of work that we've been doing. Before that, let me just also support Mary on the idea of safe spaces. Safe spaces are a proven strategy to supporting women and girls. We as UNFPA, previously we were mapping out vulnerable and marginalized girls in communities and identifying safe spaces where we could work with them to empower them. And exactly as Mary had suggested, it doesn't cost in that sense because we would look in places like get community leaders to allocate spaces like schools, maybe even a church space or halls, and then the most important thing was to get the right mentors and the right peers to guide their discussion. So those are sustainable if you work with the community leaders to identify these young girls and to allocate the safe spaces. What have we been doing during this pandemic? We're focused on young people. The online teaching, of course, is not so feasible in Africa, especially for most. So the government of Sierra Leone has embarked on a radio teaching program. They have teaching program for young people on radio. And as UNFPA, what we have done is to integrate life skills into those radio teaching programs. What kind of life skills? Topics such as menstruation, pregnancy, know your body, how you negotiate, etc. And we have at least 3 to 4 times a week, a 2-hour slot where we focus based on the age group. We empower the young people with these life skills through our radio teaching program. In addition, we have been supporting the National Youth Service. So the second thing we've been doing is we helped Sierra Leone establish a national youth service. During the COVID-19 pandemic, we worked with the Ministry of Youth to orientate this national youth corpus on gender-based violence, on the COVID-19 messages, and on protection of women and girls. And so now we have our youth corpus out there in the community educating on COVID-19, but making sure we integrated the messages of gender prevention, gender-based violence prevention, and protection of women and girls. So our young people are out there as ambassadors for us. The third thing I want to talk about is I spoke about the dignity kits which we provide. Now we usually provide these dignity kits in emergency because we cannot, of course, support people as a UN agency forever and ever. So we go into emergencies and make sure that even as people are being given food to eat, even as they're being given shelter, women and girls have the essentials to really protect their dignity. And when we know that many people menstruate, they are not able to protect themselves. And that's why we call them dignity kits. This helps them to maintain their dignity, even in emergency situations. So these are, so in giving out these dignity kits, what we did was we actively engaged young people to come and help us pack these dignity kits. because we have different items that we put in the dignity kits. And we reached out to young people, some who were at home, not really going to school, not working, and they helped us in the packaging of these dignity kits. So these are just 3 things I thought I would mention to round up in terms of what we as UNFPA Sierra Leone have been doing to help work with young people, protect and empower young people during this COVID-19 pandemic. There was a question earlier about what we've done for older people. Unfortunately, I think the person has gone. But as I said, as a sexual and reproductive rights agency, we look at women and girls without discrimination of age, race, sex, etc., etc. As UNFPA, our core mandate is around sexual and reproductive health, but specifically during the pandemic, we came together with other UN partners. We realized that there were not enough treatment centers or treatment beds in the country, and we actually worked from scratch, and within 1 month had constructed a treatment center, which is now available for very severely ill COVID-19 patients. This was something that was specific to the epidemic and not focused on our core mandate per se of getting to the 3 zeros: 0 preventable maternal deaths, 0 unmet need for family planning, and 0 gender-based violence against women and girls. I thank you very much.
Thank you so much, Kim. I think we can take one question before we need to round up. I saw Olamide. Olamide, are you there? Hello?
Hello, good evening. It was a mistake. I was trying to look at the chat. Good evening.
We didn't hear you.
Good evening. I said it was a mistake. I was trying to look at the chat and I pressed raise hand by mistake.
Okay. All right. So at this junction, I would like to thank everybody. I see a hand up there. Can you unmute yourself, Anyanwu, and ask your question?
Okay, yes. I am Professor James Chineke. Professor James Chineke is of the University. Michael Obara University of London.
Please, can you mute yourself? There's some background noise there.
Okay. I think I've introduced myself. Professor James Chineke.
Okay.
From, yes, I'm speaking from Nepal, Nigeria.
Oh, okay.
Yes. I want to appreciate you for this program you people organized. It's a very good one.
Thank you.
And I want to congratulate the youth, our children, for their day today. It's very wonderful. And I know that Madam was a princess, Honorable Princess Akobundo, the National Coordinator of Nepal. I want to thank you too for the presentations you made. And you are one of the drivers of these youth, women, and girls program under Nepal. I appreciate your presentations. It's very wonderful. Now, I have a question to ask for each and every one of you. We are talking about youth, and they are mentioning about communities. I want to know, where are the youth located? Where are they? Are the youth located in the village, in the farm? Please know, youth are located in the schools. You have the secondary school, let us say that. You have the universities, you have the NOIC, you have the colleges. These are the places youths are located. Please, I want you to do something like today. I don't know, I've not universities where you find about 70% of them, or let me say 60% of them. And for some universities, the way government treat the universities, look at, and right now, even if we open school today, I don't know the fate of the Nigerian university students. Majority of them found in public school, public universities, not private universities. So please, when you are talking about that, and the universities are on strike, we should lay some, so that one. So our youths are found, majority of them found there, and these are the people that can move. Thank you very much, and I remain grateful for the program organized. Thank you.
Thank you, Prof, for your comments. The youth are in school. Unfortunately, the schools are closed now. And I know for a fact that the federal universities are not learning anything online. That I know for a fact. So, but then it is what it is. We all have to go back to the drawing board to strategize. I see another hand up there. Remy, something?
BC, can I say something there, please?
Yes, please.
Can I just use 2 minutes to say something about that?
Okay.
On what Prof just said, and your comment as well.
Okay.
Nigerian youths are learning online. Please, let's correct that impression. They are learning online, but do not forget, like I said, the pandemic has made us to redefine whom we are. Before, we're not used to these online activities. It's not applicable in entire Africa. It's not. Yes, some use it. It's not a mandatory process of learning or teaching or doing our activities like we're doing now. But this has already made us to understand that we don't focus on only when we go to classroom, just like making us know unknown. And Nigerian government is poised to rearranging the system of learning to suit the new world. Why do I call it new world? This is a new 100.
Yeah.
Another 100 years that we're about to, we've started. And the old era has ended with pandemic trying to tell us that prepare for the future. So I want to believe that the federal government in its wisdom has put together and is still working. Like technology, I said, is the key to driving both youth development, women development, and all sorts of development in our country and continent. So Africa or Nigeria and Africa need to come back with the lesson of COVID-19, which we are all putting together. We have released our white paper on COVID-19, and we're also working to put together what needs to be done to enable us move our country ahead. So whatever lapses we're facing today is as a result of the pandemic and not knowing the future. But this has made us to know what to do, and the government at all levels are tackling it. For us in Nepal, we are going into this advocacy seriously because of the psychological trauma this might have caused our young people. And at the same time, we're looking at putting together community vocational centers where even the ones out of school can come together like an evening whatever. Like in those days when we're growing up, you do a whole lot of, we call it home economic management, we give it all sorts of name at the secondary school. Some of those things are no more in vogue. So, but this pandemic has made us to rediscover that this is a way to go, meaning it keeps us busy whether we're in school or we are at home. So I still want to plead with the Nigerian youth and the nation and the continent at large to be focused, like my sister Mary said, be focused. Don't let the pandemic be a disadvantage of your growth and your future, because you have your future to protect. If most of our former leaders never led at the old age, most of them became president at the age of 25. So do not say because government did not provide you the e-learning at pandemic period, that's why you're doing what you're doing. The youth need to be focused and know that the future is in their hands. And for Nigeria and the continent to move forward and the world at large, the youths need to reorganize themselves to be able to embrace leadership at all levels and be able to put up their innovation for a change we're talking about, to face the next milestone of life, which is the new world, I call it. Thank you so much, and I want to appreciate all participants, and BC, you're awesome. Thank you, appreciate.
Thank you so much, Honorable Princess. That is very well articulated. I see a hand up here.
Hi, it's me. Hi, my name is
Go ahead.
My name is Valentine Koyo. I work for a charity based in the UK called Mojat Foundation, and we do a lot of work around supporting girls and women and health issues. So I would like to first of all say thank you, BC, for inviting me. Lovely to see you, and thank you to all the panelists. Sorry if the question I'm going to ask is a big question that might take longer, but it's something that really bothers me. We've seen a lot of issues around an increase in domestic violence during the pandemic, which affects girls and women, and also men. And then there's also issues around children not being in school, so the relationship between parents and children has been an issue. And this has brought a lot of issues around mental health issues, which has become really tough. And I'm just wondering from our panelists, obviously, you know, there in some of our cultures, mental health is not seen as an illness because it's something that is not physical. So people, you know, don't actually treat it the same way they would treat if someone broke their hand. So it's something that is not visible. And a lot of people suffer in silence. And I'm just wondering, because if it's happening here in the UK, in England, where I am at the moment, where we are really, you know, even struggling to cope with the numbers, it must be even more difficult, like in some of our African communities. Is there something that is being done by governments or the organizations that is actually helping to, you know, to deal with the mental health of our people during this pandemic?
This is to any of our panelists, or anyone for that matter. The issue of mental health and what is being done. And this is not restricted to any age group, I believe. I think there's been increase in cases, suicidal cases. So this question is to any of the panelists. Kim?
Yeah, thank you. This is Mary.
Yeah, Mary, thanks.
Yeah, thank you so much, Valentin, for the question. It's true, the issue of mental health is extremely challenging. And of course, COVID has even made it worse. As you say, it's true, during COVID, we've seen that the numbers of violence, domestic violence, have increased, because they're experiencing a new life together the whole day, where a husband was going to work and maybe come back late. The wife was going to work, and now all of a sudden, 24 hours, they are locked up in the same house. Truly, it's a big challenge. But one of the experiences we have again experienced was to integrate the psychosocial programs within the environment where we work. And we are now looking at how we should expand on that so that we may begin to deal with mental challenges through participation. You know, when people participate and when people are kept busy and when people are given freedom to feel that they're able to express themselves no matter what, I think that also becomes part of the healing process, becomes also part of the mental health wellness. So, and of course, in our African context, as you say, when you go to a mental hospital, they see you as a mad person. But what I think we need to be thinking as Africans is the pre-preparedness before anybody can go to that level. And that's where the biggest challenge is. And I think it has to do with how people participate in the development of their families, in the development of their nations, to also feel that they are part and parcel of the whole transformative agenda that our governments are talking to us about. So the question is, how do we make sure that nobody's left behind? Since that is our commitment in our SDGs. So that becomes a kickoff way of saying, by involving everybody to start thinking critically, is also another way of avoiding, mental, issues, so that people can begin to feel they're part and parcel of the whole problem. So for me, I think that becomes outstanding, because we've seen people who have survived the worst and are proud to feel that they are part and parcel, though they claim that they can never forget, but they feel at least they have their heads raised up to be able to say, we have to leave. We have to commit to also do as good. So for me, that's how I see it. But at the same time, yes, I think our governments need to invest a lot in mental health work. So let's engage our people, let's keep conversing, let's give people opportunities to express themselves, let's open up. And I think that's the only way to go with the mental, very much mental issues that we're faced with before they get to the worst. Thank you.
Thank you so much, Mary. Tim, do you have anything to say to that? Remy, I see your hands up. You want to say something? Please unmute yourself. We can't hear you. Unmute.
Hello?
Yes, now we can hear you.
My name is Remy Adebayo. I am calling from Abuja, Nigeria. First, I want to thank Dr. BC Adebayo for this very wonderful opportunity to have people all around various backgrounds to come together, and the discussants and the panelists that have been of wonderful contribution ever since. Thank you so much. I am aware and very, very conscious of the little time that we have, and I'm going to make it very brief. As an essential worker, like I said, I am a member of the Accountable Leadership for Better Nigeria Initiative and a journalist. So as an essential worker in the period of the COVID-19, I have been privileged to move around some communities in states in Nigeria. And what I found out, of course, is that there is so much gap between the governed and the people. I've come to society or communities where I noticed that elderly women, widowed, are still left vulnerable. Even the ordinary issue of distributing palliatives, they could not be captured, they were not taken care of. We see women that have been out of jobs, young people, young women, a number of Nigerians that are still within this gap. So I would like to talk to Honorable Princess in particular because of the ideas and the mandate of NEPAD. What are being done at the level of governance to integrate all this at the level of governance with the states and communities? If you go down, a number of people will tell you that, say, a lot of interventions by government were hijacked by political actors or by people as activists. So what is NEPAD doing to guarantee and to work with government, civil society, the media, and other stakeholders that the right of Nigerians, the right of people, either girl, either women, or whatever categories they belong to, are not violated because of COVID-19? And how soon are we going to get our children back to school? Thank you very much, Doctor. I don't want to take it so long. I'm aware of the time.
Yes, thank you so much, Remy. On this note, I think we've gone over our time, and I know that page online, even though we went past all issues and things. At the end of the day, I think the issues are all clear. Something is very important that come up. We need to respond at times. And I love the 3 hours. He says, I budget 3 hours and there were 4 hours.
I don't know if this wants me to say something based on the question, what we're doing to protect the rights of women and youths and all that. And then, anyway, a lot of advocacy is going on out there. And we have integrated, we have re-established our focal offices at the state and local government level.
Sorry, there's some background noise.
Yeah, I said a lot has happened. Can you hear me? A lot has
background noise. I think Remy needs to mute. Yeah, thank you.
Fantastic. A lot has happened to reintegrate to reintegrate our mandate, to integrate our mandate to state and local government. And through media, yes, we've been doing a lot of advocacy. We have our state coordinators, we have our focal point at every local government. And you can also go to our website to check on us and give us your opinion and what you think we should do with it, and where maybe you think we should also bridge the gap on all we have just discussed, so that we can get it. And we need your information if you don't mind. We can also have your information, so you email us or you write us or say something, send us some proposal where you think we need to partner with you as a civil society or private sector to get some of these things done. Don't forget, we have 774 local governments in Nigeria, and we have 36 states, including FCT. So that's why we work with the civil societies. For example, if we have a civil society, right now, the second review of the Federal Republic of Nigeria is ongoing. What this means is to get data, informations, be able to generate what is happening, where it's happening, where are the bridges, where the bridges are going on, like what government needs to do that is not happening at certain places, what the private sector is doing there that they need the voice of the government. Like somebody asked Chibuna, have you integrated your program to government's action plan? Very important, because most times we do things independently without following the right policies and laws or directions to get it done the way it should be. So NEPAD is a tool, it's a PPP platform, where if you get these informations to us, we'll be able to redesign it, brainstorm it with you, come up with a solution, and then present it to the government for government's action. So we have we've launched a whole lot of programs on youth, on women. In fact, we have some organized civil society. We have the women in politics, because most times we use them because they will be able to address both the political challenges to ensure that politically is not manipulated at the community and at local government level. So we have them that goes out, that we incorporate, because most of our programs, since we say it's a PPP thing, we source all these civil societies according to their own mandates to ensure that the right people benefit from what we are doing. So we've done a whole lot through media. Media is our right partner, is our major partner because of advocacy. And most of our assignments, we do a lot of advocacy and launch our program. And now that NEPAD is redesigned to implement priority projects, is to bridge gaps. So we are implementing the new mandate of NEPAD, and very soon it will be domesticated in Nigeria. It's already on its way to National Assembly for the passage of the bill. So that will also help us to function more effectively than ever. So we open the door is open for all of us. Honestly, please, we welcome you. We need your own opinion. We need your own ideas. We need you to identify where the challenges are and how we can work together to provide solutions. That is the platform of NEPAD. It's designed for development. It's designed for job creation. It's designed for economic growth. It's designed to give a new faith, to give hope to the citizens. That's the structure of NEPAD, and we all need to work together to ensure that this is done. Thank you so much. I appreciate that.
Thank you so much, Princess, and thank you, Mary. Thank you, Kim. Thank you to all our participants for your patience, for staying on board. It's definitely no longer business as usual. We need to go back to the drawing board to redesign, review, and then ensure that we are realign everybody to whatever projects that we've embarked on to ensure the delivery of the SDGs. And on this note, I would like to say bye-bye to everybody, and looking forward to another opportunity for us to get together again. Thank you so much.